Come in.
Hello, Mr. Kenny. Thank you so much for being here again. We're going to continue our head-to-toe assessment today, examining the musculoskeletal system.
Okay.
I'm performing hand hygiene for your safety as well as mine. So first thing I'd like to do is start with the mandible, just examining for any deformities, making sure that we're symmetric. All right, are you feeling any pain or tenderness?
Nope.
Okay, what I'd like you to do is open your mouth, drop your jaw. Good, close that back for me. Excellent. So there was a smooth range of motion, no swelling, no tenderness or crevice noted. Next thing I'd like you to do is take your lower jaw, gut it forward, return it back to normal position, move it to your right, and then to your left. Perfect. We are going to continue by inspecting the shoulders. So the first thing I'd like to do is, I'm going to ask you if you can please remove your shirt for me.
Is my t-shirt on okay?
T-shirt on should be fine. All right, excellent. So we are going to begin by palpating at the sternoclavicular joint, tracing the clavicle lateral with the fingers. Then I'm going to move around and trace from the scapula up to the acromion. Excellent. Coming back around, palpating out, looking for the greater tubercle and into the scapula. Perfect. Any pain as I'm palpating?
Nope.
All right, excellent. So now we're going to test the range of motion of the shoulders. We're going to start with flexion. What I'd like you to do with your right arm, raise it straight out in front and overhead, and back down, and left arm, straight out in front and overhead. Excellent. Now this one I'm going to have to ask you to stand up for. This one's going to be extension of the arm. So I'd like you to start with your right arm and extend it behind you. Good. Relax, and your other arm and behind you. Excellent. The next one we're going to do is going to be abduction. I'd like you to raise one arm out to the side and then overhead. Good. And other arm out to the side and overhead. Excellent. Starting with your right arm now, I'd like you to raise it straight out to the side and bend it across your body. Excellent. And relax back down. And your other arm across. Excellent. Very good. All right, next I'm going to ask you to take your right hand and reach back to touch your shoulder blade. Good. Any pain there?
Nope.
All right, and do that with the other hand now. Good. All right, and that was testing internal rotation. Next, I'd like you to take your arm out to the side, bend it at a right angle, and move your palm up in the air. Good. Back down and back down. And do that same thing with your other arm.
Like this?
Okay, so come out to the side,
Out to the side.
bend up at a 90-degree angle, back down, out, and down.
Yep.
Excellent. So that was testing external rotation. Next, we'd like to do the crossover test. So I'm going to ask you to take your right arm, keeping it straight, cross it across your body. Good. And do the same thing with that left arm. Good. Now, very similar to how we did last time, we're going to do something called the Apley scratch test. So for this, I'd like you to take your arm, reach and touch your shoulder blade, relax that arm, bring it up behind you and touch the same shoulder blade.
Okay.
Okay, excellent. And behind, excellent. And do that with the other arm as well. Up, excellent, and then back and touch. Excellent, very good. So that was testing overall shoulder rotation. Next, we are going to assess the rotator cuff. So starting with your arms by your side, I'm going to ask you to come to 60 degrees, to 90 degrees, to 120, and then to 180. Excellent. And back down. Any pain or discomfort as we're doing that?
No.
All right, next we're gonna do the nears impingement sign. So you'll feel my hand on your back. I'm going to raise this arm up. Any pain or discomfort as we're doing that?
No.
Good. Coming to this side. Pressure on that scapula, raise the arm up. Excellent, very good. And next we're going to, and if there was pain there, that would have suggested a rotator cuff sprain. Next we're going to do the Hawkins impingement sign. So I'm going to ask you to, again, bring your arm out to the side and bring that in at a 90-degree angle. And you're gonna feel me bring that in. Any pain there?
No.
Okay, gonna do the same thing on the other side. Excellent. Any pain there?
No.
Great. Now we're going to be assessing the sits muscles, okay? So for this, I want you to bring your arms straight out in front of you and rotate them in like you're dumping a can, okay? Now try to straighten those out. Good. Try to bring them back around. Good. Any
No.
pain there? All right, and now we're gonna do the forearm supination test. So arms are gonna be straight out ahead of you and hands like you're holding a bowl, okay? And I'd like you to try and flip those arms. Any pain? Try to turn them over, okay?
No.
Again, any pain?
No.
Excellent. Last one is gonna be a drop arm sign. So what I'm gonna ask you to do is bring your arms straight out to your side and slowly let that fall, slowly let that fall. Any discomfort, any pain as you're letting that fall?
No.
Very good. Let's do that with the other side. Slowly let that fall, let that fall. Excellent. Any pain or discomfort?
No.
Perfect. All right, so we are going to, you can go ahead and sit back down. We're going to continue with the elbows, okay? So I'm gonna start with your elbow. Just relax that, let me hold that. So we're gonna palpate for any tenderness, looking for any fusion. All right, same thing on this side. Allow me to have that. Good. Palpating for any tenderness. Okay, any pain?
No.
Great. So next we are going to test your range of motion of your elbows. So the first thing I want you to do is take your elbows and bend them up like you're lifting a weight. Relax those back down. That's testing flexion and extension. Next, I want you to take your hands and I'd like you to turn them up for supination and in for pronation. Any pain as we're doing that?
No.
Okay, excellent. I'm going to move on to examining the wrist and hands. Let's start with this hand. So I'm going to be assessing for any pain, any swelling or redness. Okay, fingers are slightly flexed as they should be. Okay, we're going to be, I'm going to ask you to flip that hand over, palpating the 8 carpal bones. Flip that back over. And we're going to be palpating our MCP joints. All right, I'm going to come over and do the same thing on this side. So again, we're going to start looking at that anatomical snuff box. All right, we're going to palpate the radius and ulna. Okay. Coming around and assessing the 8 carpal bones. Great, and flipping back around and assessing the MCP joints. All right, I'm going to continue here, going to our PIP joints, assessing them for any swelling, assessing range of motion. Coming back to this hand, assessing our PIP joints for range of motion, any swelling, any discomfort as I'm doing this.
No.
And we're going to come back and assess the DIP joints. These are the ones at the very tip of the finger. Okay, looking for any nodules or nodes there, which none appear to be present. All right, excellent. So what I'd like you to do now, we're going to test the range of motion in your wrists and hands. So with your palms facing the floor, I'd like you to point your fingers to the floor. Good. And to the ceiling. Good. And with your palms down, I want you to bring your fingers towards the midline and out away. And that was testing flexion going up, flexion going down, extension going up, adduction towards the middle or midline, and abduction away from the midline. All right, next I'd like to do a hand grip strength test. I'd like you to grab my fingers and squeeze as hard as you can. Don't let me pull my fingers out. Excellent. Very good. You have a very strong grip there. All right, next with this hand, I'd like you to take your thumb and I'd like you to encase it. Then I'd like you to move your wrist towards midline. Any pain or discomfort there?
No.
All right, let's do the same thing with the other. Excellent. All right. I'd like you to try to raise your thumb as I put pressure against that. Any pain or discomfort as we're doing that?
No.
All right. And on this side, try and raise your thumb as I'm putting pressure against it. Any pain or discomfort?
No.
All right. From here, we're going to be testing abduction and adduction as well as opposition. So the first thing I'd like you to do is I'd like you to take your thumbs, move it across your palm and touch the base of your fifth finger. Good. Now move it back out to normal. Okay. Show me your hands as you're doing that. Excellent. And move it back out to normal. Now I'd like you to just place your hands in a neutral position. Okay, bring those thumbs all the way in, adduct them as far out as you can. Now take your thumbs and tap the ends of each finger starting with your pinky. Good. Good. Any pain or discomfort as we're doing that?
Nope.
Excellent. You can relax those hands. Next, to test for medial nerve compression, I'm going to do Tennelle sign. If I can have your wrist, I'm going to be tapping on the medial nerve. Okay. Any pain or discomfort as I do that?
Nope.
All right. And again on this side. Any pain or discomfort?
Nope.
All right. Last, we're going to assess Phelan sign. So what I'd like you to do, take your hands, you're going to put them back to back together, elbows up to the side. Okay, and we're going to hold that position for about 30 seconds.
Okay.
Any pain or discomfort as we are doing that. All right, continue to hold. Let me know if you feel any numbness or tingling in those fingers.
Nope.
No? Okay, you can relax there. All right, we are going to continue the examination with examining the spine. For this, I will ask you to take your undershirt off.
Okay.
And if you will stand up for me. So I'm beginning the examination. I'm looking at the concave nature of the cervical spine, the convex nature of the thoracic spine, and concave of the lower spine. Okay, from here, I'm going to palpate down the vertebra. Any pain or discomfort as I'm doing this?
Nope.
Out to palpate muscles at the back. Any pain in your deltoids?
Nope.
Okay, trapezius.
Nope.
All right, no pain or discomfort as we're doing that.
Nope.
All right, next I'm going to ask you to please lie flat on the table.
Okay.
And if you will roll to your right for me, keep that bottom leg straight.
Bottom leg?
Yeah, bottom leg straight. And here I'm going to be assessing for the patient's sacroiliac joint. My patient is very ticklish. My apologies.
So sorry.
All right. All right. And again, we have assessed no tenderness. All right, you can come back to sitting for me. What I'd like to do next is test the range of motion of your cervical spine. Take your chin, touch it down to your chest, and take your head back. Look up to the sky. Good, bring it back to neutral. Good, I'd like you to look over your right shoulder. Good, look look over your left shoulder. And then I'd like you to take your ear to your right shoulder and your ear to your left shoulder. Any pain or discomfort in the neck as we're doing that?
Nope.
Perfect. So we were testing there with chin to chest flexion, extension with the patient holding their head back, rotation, having the patient look over either shoulder, and lateral bending from side to side. All right, next we're going to test the range of motion of your lower spine. I'd like you to stand up for me.
Okay.
All right, and for our test of flexion, I'd like you to bend over and try to touch your toes. All right. Any pain or discomfort?
Nope.
Good. Come back up. I'm going to support your lower back, and I'd like you to bend back. Good. Any pain or discomfort there? All right. Next, I'd like you to rotate your upper body from side to side. Okay, leaving those hips as much straight as you can. Good. And then I'd like you to bend right arm down and left arm down. Good. Any pain or discomfort as we're doing that?
No.
Perfect. We're going to continue on to examining the hips. I'm going to start this by asking the patient to walk. Okay, if you can just take a walk across the room for me. Good. And back towards me. Excellent. So I am assessing his stance and gait as he is walking. Okay. So from here, if I can have you to go ahead and lay back for me on the table. And this may be a little ticklish, okay? So I'm going to start by palpating the patient's iliac crest, moving out to the iliac tubercle, coming in until we get to the patient's greater trochanter, okay? And if I can have you roll over for me to your belly.
Okay.
And again, we're going to be palpating for that iliac crest. And then the greater trochanter at the level of the gluteal fold. All right, you can flip back over to your back for me. All right, next we're going to check the flexion of patient's hip. What I'd like you to do is bring one knee up to your chest, hug it in with your leg as close as you can get it. Just want to leave this one straight for me. Excellent. Let that go. Do the same thing on the other side. Good. Exactly. All right, for extension, I'm going to ask the patient, can you move a little closer to the head of bed for me? Perfect. Perfect. And here, I'm going to ask the patient to bring this leg over and go a little closer to this side of the table for me. Excellent. Move the leg over and drop it down off the table. And we're going to do the same thing on the other side. Moving the leg over and dropping it down. Any pain or discomfort as we're doing that?
Nope.
Excellent. Next, I'd like you to allow me to move your leg. So we're going to be testing abduction, taking the patient's leg away from midline, adduction, crossing it across patient midline. Doing the same thing on the other side. Abduction, taking the leg away from midline, adduction, back across the midline. Any pain or discomfort as we were doing that?
Nope.
Great. All right. Next, I'd like you to bend one leg up, and I'd like you to twist this ankle out. Any pain or discomfort?
Nope.
Good. Now coming in.
Nope.
Okay. Great. And we're going to repeat the same thing on this side. Any pain or discomfort there?
Nope.
Great. So that was looking at internal with external rotation of the hip. All right. I will give you back your shirt and let you put that back on. You can go ahead and sit up for me.
Okay.
All right. So next we're going to be going to examination of the knees. Is it okay if I pull the pants legs up? Great. So just looking at the knees, I'm going to palpate. We're looking for any tenderness, bogginess. All right. Any pain or discomfort as I'm palpating?
Nope.
Great. Next, we are going to, I'm going to ask you to straighten your legs straight out, as straight as you can get it, and bend it back in. Any pain or discomfort with that?
Nope.
How about on this side?
Nope.
Great. All right, from there, I'd like you to take your leg and I'd like you to swing it towards your midline and back away. Good. Do that same thing with the other leg. Swing it towards your midline and back away. Any pain or discomfort doing that?
Nope.
All right. I'm going to let you go ahead and lay back on your back. All right. So for this, we're going to be testing the MCL. Okay. So I'm going to take the patient's leg, bend that up towards knee. Okay. So here I'm going to be pushing in on the leg and pulling out on the ankle. Any pain as I'm doing that?
Nope.
Great. I'm going to repeat the same thing on this side, slightly bent. Okay, pushing in and pulling out. Any pain?
Nope.
Great. So we are going to do the exact opposite of that. So here, I'm going to lift the patient's leg slightly bent. Hand is going to go on the outside. We're going to push in. Any pain?
No.
Okay. On this side, push in. Any pain?
No.
All right. Next, we are going to test the ACL. This is going to be with the anterior drawer sign. I'm going to ask my patient to move slightly to head of bed. Great. Go ahead and bend this knee up, make a mountain out of it. Now, in doing this, we are told that we need to support the patient's foot, and some texts will suggest that you support it by gently sitting on the patient's foot, which I'm going to do. Here, I'm going to put my fingers on either side of the knee, hands are wrapped around the back of the knee, and explosively pull forward. Any pain?
No.
Great. We're going to do the same thing on the other side. Any pain?
Nope.
All right. So for the next, testing our PCL, I'm going to do a posterior drawer sign. Ask the patient to move his foot right back up. We're going to come back in that same situation, and same position, except for this time, we are not going to be pulling, we're going to be pushing. All right. All right. Any pain?
Nope.
And we're going to do that again on the other side. This is again doing the posterior drawer test. Hands are around the back of the knee. Rapidly push. Any pain?
Nope.
Great. And that's testing our PCL. All right. Next, we are going to examine the patient's feet and ankles. My apologies. I know your feet are very tender and very ticklish.
Yes,
I will be as
sorry.
gentle as possible, okay? So I'm going, is it okay if I remove your socks?
Yeah.
And I'll do my best to put enough pressure that it is not ticklish for you.
Yes, please.
Okay, excellent. So, first we're going to start. I'm going to use my thumbs and assess the feet, feeling for any bogginess, swelling, or tenderness. Feeling back to that Achilles tendon. Again, palpating any tenderness back there. Great. Okay, I'm going to ask you to just relax. I'm going to be palpating the heel. Same thing here, palpating that heel. Great. I'm going to be palpating our 5 metatarsal joints. Just relax those toes. Great. And next, what I'd like you to do is take your feet Point your toes up as far to the ceiling as you can. Great, and put them down like you're driving a car. Excellent. Any problems with that?
No.
Great. Okay, next I'm going to be stabilizing the patient's heel, and I'm going to move the ball of the patient's foot in and out. Any pain or discomfort as I'm doing that?
Nope.
Great. Moving the patient's foot in and out, testing inversion and eversion. Next, I'm going to do the same thing, grabbing at the ball of the patient's foot, moving the heel in and out. Any pain or discomfort?
Nope.
And again, in and out. No pain or discomfort there.
Nope.
All right, and then we're gonna go to the toes, and we're just gonna wiggle each one to make sure that there is a full range of motion and no pain. I'm so sorry. All right,
Yeah, no pain.
moving through. No discomfort there?
No.
Great, I'm gonna ask the patient to go ahead and come back to a sitting position for me. All right, we're gonna continue the musculoskeletal examination, doing a muscle strength test. So for this, I'm going to ask the patient to let me support their elbow. I'm gonna take that shoulder through a full range of motion. Great, coming to this side, allow me to support, taking that arm and shoulder through a full range of motion. Great. What I'd like you to do is allow me to take your feet. We're going to be testing muscle tone in the legs. Allow me to straighten and bend. Is there any discomfort as we're doing this?
Nope.
All right, again on this side, straighten and bend. Any discomfort here?
Nope.
All right, now we're going to test the flexion of your biceps. I want you to hold your arms up, and I want you to pull against me. Great. Now I want you to push against me. Great. Very strong there. All right. And I'd like you to make a fist, and I'd like you to push down against my hand. Good. Push up against my hand. Other side, make a fist, push down against my hand and up against my hand. Great. Again, we're going to test your grip. Do not let me pull my fingers out from you. Excellent. All right. Next, I'd like to test the muscle strength. Okay, do not let me close your fingers in. Good. All right. And I'd like you to try and touch your thumb to your finger, and I'm going to try and resist that movement. All right. Excellent. Doing it again on this side with me resisting your movement. Excellent. All right. Next, I'm going to ask my patient to lay back for me. And so we are going to examine the lower extremity here with flexion of the hip. All right, keep that leg straight. Go ahead and straighten that leg up against me. Keep it straight, keep it straight, keep it straight. Excellent. We're going to come around and do the same thing on the other side. I'll put pressure down. You lift up straight against me. All right. Very good. All right. Now, I'd like you to push down on me. Push down on me. Great. We're going to do the same thing on this side. Keeping that leg straight, push down on me. Great. Excellent. Next, we're going to test abduction. I want you to try and take your legs away from the midline against my pressure. Okay? Great. And try to bring them in against my pressure. Bring them in. Excellent. All right. Next, I'm going to bring the patient's leg into flexion, and I'm going to support the patient's knee, and I'm going to ask you to straighten against me. Straighten against me, pushing down. All right, very good. We're going to do the same thing on this side. Supporting the patient's knee, I'd like you to straighten that leg against me. Very good. All right. I can, last, we're going to test dorsiflexion. I'd like you to pull your toes up against me. Lift, 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 and I'd like you to push down against me. Push, 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 push. Very good. All right, next I'm going to ask my patient to go ahead and sit up for me. We're going to continue with a assessment of coordination. What I'd like you to do for rapid alternating movements, I want you to take your hands, you're going to slap your thigh front and back as quickly as you can. Excellent. You can go ahead and stop that. Taking your thumb in order, I'd like you to start at your pointer finger. 1, 2, 3, 4 for pinky. 1, 2, 3, 4. And repeat that for me. Again. Perfect. All right. We're going to be assessing point-to-point movements. All right. And so for this, I would like for you to touch my finger and touch your nose. Okay. My finger, your nose. My finger. Bringing that back out. All right. Relax there. Now I'm going to keep my finger here. I would like for you to close your eyes, raise your arm up overhead and back to my finger. Okay, close your eyes. Good. Do it again. Keep doing that. Okay, one more time. Great. And do the same thing with your other. Hands in the same place. Very good. And back in. And last one. And back in. Excellent. All right. Now, we're going to continue with a heel to shin movement. For this, I'd like you to take your right heel and move it from your knee, slide it down to your foot. Good. Other side. Excellent. Now, I'd like you to do that again, but this time with your eyes closed. Great. Now, we're going to continue the examination by asking the patient to walk. So I'm going to ask you to stand up, just as you did before. Walk right across the room. Here, I'm observing the patient's balance, posture, their arm swing, and leg movements. Excellent. All right. Now, before you sit back down, come back up. I want you to walk to the edge of the room, just right where the wall is, on your tiptoes. On your tiptoes. On your tippy toes. On your tippy toes. Great. And turn around. Come back to me. I'd like you to walk on your heels. That one's a little more difficult for some. All right. Do not sit down yet. What I'd like you to do is I'm going to support your arm. I'd like you to hop on your left leg. Okay, so right leg's up in the air. Good. We're going to do that on the other side. Excellent. And relax there. Next, I'd like you to do a shallow knee bend. Okay. Now, I'd like you to relax one leg. Do it only with your right. Okay. Only with your right. Good. And the other side. Repeat that for me. Perfect. And we're going to finish out by doing a Romberg test. The first thing I'm going to do is I'm going to have my patient just stand, eyes are closed, and we're going to just stand. And I'm looking for any type of swaying that the patient may have. Okay. Looking at their ability to maintain an upright position and very minimal swaying. Okay. Excellent. Now, go ahead and open those eyes. We're going to do very similar, the same thing, except for this time, I want you to bring both of your arms out in front of you, okay? And close those eyes. And we're going to be watching this for about 20 to 30 seconds again, making sure that the patient can maintain that arm position. Making sure that those arms pop right back up as I try to move them. Perfect. You can go ahead and relax, and that has concluded our musculoskeletal and assessment of muscular strength and coordination testing. Thank you so much.
All right, thank you.